Good day, and thank you for joining us. My name is Russell Hendrickson, and I'm the CEO here at Practical Data Solutions. And thanks for joining us for today's webinar, Healthcare Analytics Trends in 2023. And I'm pleased to have Scott Everett joining me, who's our Vice President of Healthcare Solutions.
Hi, everyone.
So today's webinar, we're talking about healthcare analytics trends in 2023, or we could just say we're talking about healthcare trends in 2023. We thought that sounded like a better title for a webinar than, is there life after COVID, or what do we do now that COVID is quote unquote over, right? But in any case, we need to talk a little bit about, when we talk about trends and where organizations are focused, healthcare practices, we really need to start with what went on with CMS and with Medicare. So let's jump right into that topic first.
Yeah, so when we talk about 2023, obviously the trend is the same as it always is it's going to be a balancing act. Now, what CMS has done, and CMS drives everything, is they've gone through and they've put through a 2% decrease in the RVU conversion factor for this year. Now, this 2% decrease, we should actually probably be a little thankful for it, because in the original physician fee schedule rule that was approved, it was actually going to be about a 4.5% decrease, coupled with a 4% PAYGO decrease related to the 2021 RVU changes and the budget neutrality. So the 2% is actually a better outcome than we hoped for originally. Now, it's not a straight 2% though, because they changed the RVU values and calculations for a number of codes. They changed the work RVU values fairly significantly for the inpatient admission and observation codes that are out there, changed some of the coding requirements for those as well. And then in addition to that, they changed some of the calculations for the practice expense and malpractice components of the total RVUs, and that affected several hundred codes. Not all of the changes were very large, but they were definitely non-zero, and they will impact reimbursement. And then in addition to that, as if that wasn't complex enough, they modified GPCI calculations. So depending upon where your practice is located, you may see reimbursement slight increases or decreases based upon the new GPCI calculations that are out there.
So once again, some fairly significant changes. Scott, as you mentioned, right, they only took the T off of reimbursement, not the whole bursement off of reimbursement. And so, what does that mean? Where are practices focused? We have the opportunity to work with healthcare organizations all across the country every day. And where we really see practices focused in some of the key trends, obviously, is focus always on productivity. We're also going to talk about the managing costs in particular, because some of the changes with reimbursement and some of the challenges related to staffing in particular, which is a key challenge across the country, not just for healthcare, but all organizations. And then, of course, patient satisfaction, or the kind of the key buzzword that we hear about is patient experience, and that's still center and focus to practices. So with that, let's dig a little further though in understanding the impact of Medicare reimbursement, and then how do we translate that into looking at productivity?
Yeah, so obviously, if we want to know, exactly what we have to do in order to increase productivity or what levels we need to get to, we probably ought to model out and see where we are. And so we can look at, the impact that the Medicare changes will have on our practice, whether we're a practice that has a very high Medicare payer mix or a lower Medicare payer mix, it's going to impact us a little bit. And the issue is that if it was a straight 2%, that's a fairly easy analysis. But since we've got to incorporate in those RVU changes, it's going to vary from department and specialty to department and specialty. And so you may have areas your hospitalists are going to be loving it, whereas the some other specialties may be losing quite a bit more than 2% based upon some of these other changes. So it's really kind of important to be able to dig in and dig down and understand who are the winners and losers based upon this.
Yeah, and so, really understanding where you are and anticipating what's coming is certainly key. Most organizations do budget, or at least try to understand the impact of the changes with Medicare. For organizations that have, better analytics and are data driven, we're seeing the trend of being able to literally go down and analyze all the way down to the procedure level, starting to understand what is the impact of these proposed changes by analyzing what we did in 2022, and then assuming if we do the same amount of volume of services, how does that roll out to the different departments or even down to the different physicians based on our current basket of services, right? And so that's really key in being able to try to understand the impact. And then ultimately, what do we do with this information, Scott? How do we then use this to better drive productivity?
Well, I think once we know where we are from a decrease in reimbursement standpoint, then that helps us to understand in order to make up for that, we need to either increase reimbursement with our commercial contracts or make sure they're performing better, or increase productivity with our providers. And we can look at productivity a couple of different ways. We can look at it from an RVU standpoint, we can look at it from a visit standpoint, but probably what we're going to have to do is take a look at where we need to be from a budget standpoint and maybe even adjust those expected RVUs or budgeted RVUs or budgeted visits. And I don't know, the best way to do that is maybe, either increase the targets, maybe utilize some internal or external benchmarking, compare your providers against each other to their peer groups in the region. Some of these ways, we need to find ways to kind of tick up that productivity a little bit to make up for the reimbursement cuts.
Yeah. So doing, physician dashboards like you see here certainly is not a new item, although some organizations, and we'll talk about, still struggle with the ability to do that in an automated or in a timely fashion. Those can be limitations. We certainly see a trend, but, Scott, as we talk about this, sort of pushing all the physicians on productivity, and certainly setting targets and goals is valuable. But if we have analytics behind it, where we want to focus as a data-driven organization and where we see practices focusing is, we may be able to just go into our data and say, let's not worry about the physicians who are generating, above the average of their department or their specialty. Let's focus in on the physicians that are generating below, that either have low work RVUs or low performance. And then we can start to analyze, is it based on coding or the charge lag? Or maybe they just don't have enough patients in their schedule, or even what's the impact. And we're going to talk a lot about patient experience coming up. So being able to sort of slice and dice through the data and understand, potentially where the focus needs to be, that's where we may want to have better benchmarks, targets, or even consider changes to our compensation. Okay. One of the other things that we do see, though, more and more organizations heading towards, and is certainly a trend, is being able to project performance improvements. If we move those physicians that are performing, let's say, below the average in our organization, can we project out what would be the total impact on revenue on a monthly or on a performance basis by trying to focus on the bottom third? Really key in terms of understanding then how do we help physicians, support physicians, and help ultimately drive better performance to improve the bottom line.
Yeah, and we talk about, these areas of increasing this productivity as a way that maybe we have a little bit more control over than other areas. We talked a little bit about, our commercial contracts and seeing what we can do there. And again, we may or may not have a lot of control over what their reimbursement is. From that standpoint, but what we can do is we can start making sure that we're getting the reimbursement that we expect from them. And whether that's looking at something like underpayments for various procedures that are out there by the payer level, or what I like to look at is payer performance, particularly around denials. And what I don't think a lot of people realize or put into their calculations with reimbursement from their commercial payers is the impact that denials have. And so we do have a little bit of control in how we can mitigate our denial rates and maybe work towards some denial prevention. And where we can't prevent, we need to make sure that we're recovering at the highest level possible so that it's not totally dragging down the reimbursement rates we're getting from these commercial payers as well.
Yeah. And, going a step further, evaluating our contracts certainly is one way to increase, performance, certainly increase revenue. So having, again, data-driven organizations, that's another sort of key trend, is organizations trying to rely on data, but being able to go in and analyze proposed agreements and understand what's the impact of various proposals, because it's one thing for the payer to say, well, it's going to be a 10% increase over last year, but until you apply it to your various procedures, your mix of business, and really then if you're a multi-specialty organization, try to understand that, in some cases, most departments or divisions are going to win, but there might be a specialty or two that's going to take a hit. Overall, it may be a good contract, but having data to make decisions is really a key trend, and making sure that we've got data to the next level. It's not enough to keep running our organization on sort of those old reporting tools. We need to make sure we've got timely data that allows us to understand and analyze quickly so we can better negotiate our positions.
Right. So the next trend, while we're looking at these reimbursement cuts and decreases, the next trend to look at is controlling our costs. And it's kind of funny because, here in the United States, we hear all the time about we need to do something to drive down costs. We need to do something to drive down healthcare costs. Well, the thing is, when they're talking about healthcare costs, they are in no way discussing what it actually costs to provide care in this country. What they're talking about with healthcare costs is cost to the patients, like the premiums or the out-of-pocket expenses. They're talking about costs to the payers, particularly CMS, and what they're reimbursing to the providers. They're not talking about what it takes and what expenditures have to be made in order to provide care. Talking about building costs, insurance costs, which are quite high, IT costs, which are required in order for us to run efficiently and have high quality. And then, of course, your administrative salaries, billing costs. All of these are what are needed to go into having the highest level of care that we can provide. And these are the things that we're expected to mitigate. So when we look at it from a typical financial financial statement that's run on a monthly basis, we can see where our highest expenses are. We can tell what we have control over, and maybe small areas here and there where we can cut costs, but I'm not sure that's necessarily the best way to look at it. If we really want to be data driven and get down to the next level, what we want to do is we want to get to a much more granular level.
Yeah, and so here's an example where, going back to physician level detail, we've seen organizations do this in the past. I don't think it's a norm, but it seems to be a trend in particular right now is, really focusing on physicians and contribution margin, especially where we're seeing, hospitals and health systems acquiring physicians, and extending, the various specialties that support the hospital or the health system. Being able to go down and say, let's look at the physician or the division and how is that contributing to the organization? What is the contribution margin? And one of the biggest challenges with doing dashboards like this in the organizations that are doing these, but there's certainly a trend to look at physician contribution margin, especially as it relates to compensation. But the big key here is, how do we allocate expenses? Because that's easy when we have direct expense, but it's not so easy when you think about IT costs, or even how do you rent on a very large health system or on a physical building. So it begs the question, how do we allocate costs if we're going to try to do something with contribution margin, and how do we do that in a meaningful and sort of fair way?
Yeah, so there's a couple of ways that we've seen that organizations are starting to look at this allocation methodology. One is by RVU, and looking at expense per total RVU or expense per work RVU within your organization. And what that really does, and the advantage to that, is not only does it help you kind of fix your costs and allocate those across the providers based upon their productivity, but it also helps you to look at individual procedures and start looking at break-even points to understand maybe where you're profitable, where you're not profitable for certain services and certain contracts, or even Medicare, to say, here are services that we're providing where we're not even at kind of a break-even level. Other way to look at it is by visits that we're seeing, where they can allocate these expense by the number of visits that come through the clinic. Some of the providers like this more, particularly the higher performing providers or higher RVU driving providers that are out there, who don't necessarily view it as fair to have them share these same fixed expenses, where the expenses are the same for even the ones who perform at a lower level than they do. So if they do it by visit, then that can be a much more fair, equitable allocation, depending upon your organizational culture or your organizational priorities. Those are a couple of different ways that you can look at it.
Yeah, I don't know about you, Scott, but I've been in more than a few meetings where this becomes a hotly debated topic, and I've even seen it clear the room in some cases where people can't agree on what's a fair allocation method. But in either case, I do think even if it's something that's just being used by leadership, it's important to be understanding contribution margin and where are those break-even points across the organization. As we continue to talk about costs, one of the key trends is we're obviously in a labor shortage. I don't know any healthcare organization, certainly all of our customers and the people we talk to in many cases are still struggling to get the staffing they need. Just about every physician's office I've been in personally, I see something like this sign on the wall saying, "Be patient, we're understaffed," which could even be when you try to pick up the telephone to make a call or ask a question. So, clearly labor shortages impacting productivity, care team productivity, and ultimately the patient experience, which we're going to talk about. But Scott, what's key here to tie together in terms of trends that we're seeing in organizations?
Well, I think staffing kind of is its own animal when you look at it, because if you look again at, a typical P&L or a balance or a operating statement, then you'll notice salaries and wages are probably your highest costs that you're dealing with out there. And when you look at it from a labor shortage standpoint, it's probably not something where you can look to cut costs by reducing staff, because you're probably short staffed as it is already. You probably can't cut costs by lowering wages because you're in a labor shortage and they'll go somewhere else. So what you want to look for are the efficiencies that you can find within the other expenses that come through your staffing needs. And so look at some of these other metrics that are out there where you're maybe trying to optimize productivity and looking at the RVUs that are generated per FTE and break that down and see where you're more and less efficient spaces that are doing this. You can look at the cost management where you're try to reduce overtime and try to balance your PTO hours a little bit better. Or if you really want to get down to it, then you need to understand your turnover margin and understand your recruitment costs, particularly if you have bonus outlays for new hires, things like that. Your recruitment costs can be really high, and so you want to really balance your turnover, look at staff satisfaction metrics, performance management, things like that, where you can really drive down these other costs that go into your salaries and wages line item within your income statement.
Yeah, some real challenges, and of course you mentioned the word trying to cut costs or drive down costs. And we've talked about this in the past, but the next key area certainly that we see practices focused on is patient experience. And I always think, at least intuitively, it seems like if you want a better patient experience, you're going to have to spend more money, right? But we've just finished talking about some of the trends here where we've got some, small decreases with Medicare. We've got increased staffing costs. So how do we go about balancing patient experience and trying to focus on patient experience? And those are some of the trends and the challenges that organizations are facing today.
Yeah, so when you think about patient experience, obviously, we're looking at the full suite of things, but it's really interesting that, we've had more organizations coming to us asking to look at what feeds into patient experience and how they can really go about moving the needle in that area. And what's really interesting is we found this great survey that was done in September 2021 by Press Ganey talking about consumer experience and what those trends are. And a lot was out there based upon the online reviews from Health Grades, from the other, online areas that are out there where, patients read these before selecting a provider. And a really interesting statistic we took from this is said that 84% of patients would not see a provider, even if they were referred to that provider by their primary care physician. They wouldn't go if that provider had less than a 4-star review. And so it's really important to know what those online reviews are saying and understand why they're saying it, because when you really dig into it, care team is really important with that. 71% rate customer service is the most important factor. And so when you think, oh, well, it's how nice the provider is or their bedside manner or how well they communicate, 71% say customer service is most important. And you know what's interesting? You know what second most was, Russ?
I don't. I would always think it would be the physician themselves.
Nope, it's cleanliness of the office.
Hmm.
So yeah, care team has a big role that they're playing in this. And so we really need to focus on that care team.
So in addition to looking online, looking at online reviews, understanding what patients are saying, the other place that we're seeing a trend right now is more and more organizations, relying and digging into the patient survey data. Most organizations do patient surveys, but more and more we're seeing the importance of being able to present that information, share that information, and share it in a visual way, whether it's in a dashboard that just communicates sort of some of the key ideas, like how is the physician being perceived, but also, Scott, to your point, would they recommend the group, right? And so this is an example where we see more and more organizations sharing information and trying to share information visually so that it's very quick to see the care team, that practice location can quickly see areas that are in yellow are really where we're scoring very low. And you notice there's a big yellow bar here under communicating with the practice on the phone, ease of scheduling appointment, and then scheduling staff was courteous. And, so those kind of challenges and understanding and communicating is really key.
Yeah, I think, looking at this is important, and it's important to really understand, our patient surveys and what's driving those. But again, I think, that level of granularity is important, where we can come in and we can start looking, by department, by division, by clinic, by provider, being able to look at individual care teams and maybe even just focusing in on our lower performing areas, our lower performing providers, who are the ones who have the care teams that are struggling a little bit, who are the ones that are struggling with access, being things like that. And then we can really dig in even to individual questions and categories to understand, what are the drivers of these scores? Is it access? Is it care team? Is it cleanliness? And really kind of look at individual questions on these surveys, how those are answered by who, and things like that. So, really being able to have the data available to leadership to help them work with those lower performing areas and find areas that have maybe, causing 80% of our problems in 20% of these areas.
Yeah, without a doubt, needing to be able to analyze that data effectively to help drive decision making.
Yeah, so I think another place we can look at too is, with chronic care and looking at our patients. It's interesting because every single industry, drives so much of their business based upon their returning customers. You look at travel and hospitality industry with your frequent flyer miles, with your your Marriott rewards points, your rental car, preferred status, things like that. All of that goes into play. We don't do that enough in healthcare.
Yeah, I don't know about you, but my primary care physician now gives me rewards points and stickers in their mobile app for how many E&M. No, I'm kidding. They're not doing that, but it would be certainly make it interesting, right? Gold, silver.
Yeah.
I guess I got the gray hair going, so maybe I'm already hitting the silver now. But anyway.
Yeah, no, I think it's important though that when we look at that, there is a way that we can go in and we can see who our patients are that require the most care, that are our highest risk patients, and ones that maybe, if we're being a little bit proactive, not only increases not only increases the quality, not only increases their patient experience because they feel like they're cared about, but really in the end, if we're providing these right services for them, then it's going to improve our financial performance as well. And so we're really talking to a lot of organizations about utilizing risk scoring, not just with their value-based care contracts, not just with Medicare Advantage, but with all of their payers, even their fee-for-service payers.
Yeah, this is kind of a key topic. We had a webinar on this fairly extensively in October. That's available up on our website and our YouTube channel. And really the key is if we can stratify our population and understand where those patients that have a higher need for care and we can provide better care, not just for value-based contracts, but overall, we can improve the patient experience and ultimately drive up revenue and opportunity. So certainly encourage you, if you're interested in learning more about that, to take a look at that. And that's been kind of a key trend centered around patient experience and continues to be.
Yeah, so we've spent a lot of times in these areas today, and these are definitely the things that we're hearing and that we're seeing in the industry right now, is that there is a need to increase productivity. Where we're coming out of COVID, we need to get people more engaged, get our patients back on appropriate care plans, particularly our higher risk patients. We need to make sure we're managing costs, that we're appropriately staffed, and that our patients are having a great experience, because the competitive nature of the industry is getting higher as well. And so obviously the way we need to look at this then is we need to have leadership driving this. Leadership needs to be driving all of these areas, and they need to be data driven. They need to be able to look at the data, see what the data is actually telling them, and they need to have data accessible to them. Because at the end, what they're really trying to look at is optimizing operations and eliminating inefficiencies. And that may come both in the practice, or it may come on the administrative side as well.
Yeah, without a doubt. And so when we think about data-driven organizations, which continues to be sort of a key focus for organizations, I don't know anybody who would say we're going to focus less on data in 2023. And for obvious reasons, but being data-driven isn't just supporting leadership, it can actually be driving more efficiencies. And so, this is representative of what we see. If you think about manual reporting, let's say we want to do, monthly, organizational reports or monthly physician dashboards. Typically the analyst might go around and collect data. They're going to run data reports out from all the different systems, the practice management system. They're going to might run data out of scheduling system, the patient surveys, the general ledger, budget benchmark. And then the next step is, after they've sort of run all those reports, they're going to have to somehow try to blend it together, usually in Excel or Access. They're going to try to crunch through some data and try to make some sense of it. How do we put it all together? And then if that isn't challenging enough, then the last step is, how are we going to go about delivering the data? How are we going to then set it up so we can email it out or burst it out or print it, whatever we're going to do? And in a 5 physician organization, that can be a challenge, but in a 50 or a 500 physician organization, it becomes almost overwhelming, right? Because we have all these different manually touch points.
Yeah, and I know when I was back a long time ago managing practices as well, I know these areas really caused a lot of pain and inefficiency. Obviously, collecting data is very time consuming. You have to make sure it's right. You have to make sure it's the right data and formatted the right way. And then when you try to blend it into dashboards and you're copying and pasting for 200 different physicians, that there are just so many opportunities to make errors in those situations. And then of course, delivering it out is also inefficient, where you're trying to, attach the correct reports and email out to 200, 300 different people exactly what they need. That can be a difficult process. So there's definitely some inefficiencies in there.
Yeah. And then to add to it, we have to start it all again, 4 weeks later, right? Run it again, because we're sort of inefficient in our processes. So when we think about organizations that are growing, we think about trying to be efficient with analytics. And then we also think about the cost of hiring more staff to do somewhat antiquated processes. There's still a trend to looking for analytics. Everybody's got a data warehouse. Everybody has some analytics tools, but how do we drive better ROI by, instead of moving to manual processes, but looking at tools like the PDS Task tool that some of our clients are using on the call here today, but just overall looking for analytics to drive efficiencies, so the staff that we have are more efficient and can provide better data and blend the data so we can focus, is key. The other areas, we still see organizations also trying to optimize their use of analytics. And we've talked about this in the past, but organizations that are using one tool, let's say Tableau for visualization, maybe they're using Excel cubes for slice and dice, and then they've got to move to, say, something like Business Objects or Cognos for the detailed reporting. Not really efficient because they don't have a single standard of data. They're having to move between tools every time they want to move from visual to slice and dice to detailed reporting. So one of the other trends still is, how do we streamline those tools? How do we move to a single tool set that can serve the users, whether they need to do detailed analysis, contract modeling, or overall, publishing out, just getting the right information in the hands of the right people the right way.
Yeah, so, to sum up what we've talked about today, obviously, the biggest trends that we're seeing are increasing our productivity. We need to find ways to find, additional revenue streams that can come across. We need to balance everything, and we need to make sure that we have data in the right hands of the right people in order to make sure that they're optimizing all of these different areas, and that they can get down to a granular level so that they're not trying to manage everything with a one-size-fits-all approach, but they're able to go in and do it with a scalpel, so to speak, and take out the small areas that need to be changed, and then keep the ones that are working well.
Yeah, very well said, Scott. I would be remiss if I didn't put in a little plug for PDS here. Our expertise is around staging and modeling data in all the areas you saw in today's webinar, but also in pretty much any area of your healthcare organization. We have the ability to bring in tools that can drive ROI to help you blend data faster and more efficiently, or replace some of those legacy systems. And we've been doing this for over 23 years. So we bring proven methodologies in terms of even how to look at metrics and help your organization drive performance improvement, cut costs, and ultimately be able to put an ROI behind your analytics. So just a little bit about PDS, and we'd certainly love to hear from you. We hope you have a great day, and certainly think about and focus on where your organization's headed and how are you tackling some of the things that we talked about today. So appreciate it.
Thanks for joining us, everyone.
Thank you. Have a great day.